Hi, I'm Roger Mashad. At Franklin Templeton Investments, we believe that citizens need to be informed about the resources that can help make higher education more affordable. That's why we're proud to support programming produced by the Caucus Educational Corporation and their partners in public television.
Funding for this edition of Caucus New Jersey has been provided by the Turrell Fund, supporting right from the start NJ, Wells Fargo, Holy Name Medical Center in Teaneck, New Jersey. Healing begins here. New Jersey Sharing Network, dedicated to saving lives through organ and tissue donation. Fedway Associates. NJ Best, New Jersey's 529 college savings plan. Turn a dream into a degree. And by the law firm of GIBBONS, PC. Promotional support provided by NJ Biz, all business, all New Jersey. And by New Jersey Monthly, the magazine of the Garden State, available at newsstands.
Hi, I'm Steve Adubato. Welcome. We're talking about college affordability with someone who knows it very well. He is Robert Kelchen, Assistant Professor of Higher Education at Seton Hall University and the author of Higher Education Accountability. Good to see you, Robert.
Good to see you. Glad to be here.
Let's talk about affordability. There are a whole bunch of folks watching us right now in more than a few states saying, you know what? I went to school, my kid went to school, and I've got a ton of debt. Is that the norm? Is it the exception? What is it?
There's a lot more debt than there used to be. The typical debt for someone with a bachelor's degree is about $37,000 right now. But if you went to graduate school, or if you went to an expensive private college and your parents helped you pay, that's where you see $80,000 to $100,000 in debt or even more.
And graduate, by the way, I should disclose that our son is in graduate school at Seton Hall as we speak right now, and I can attest to what you just described. The whole thing is that people think they know. Some people think they know what it costs to go to college, but then they face sticker shock. Describe it.
Colleges charge different prices to different people, but the way they do that is they set a high price as a sticker price for everyone, and then they'll give you grants or scholarships based on financial need, academic ability, whether you're good at sports or something else, and you end up with students paying a whole range of different prices. But the concern with that is some people may get scared away by seeing that high sticker price and not going through applying and actually seeing the discount that they'll get.
Let's talk about this a little bit. Can someone or a family with a child, with no longer a child, going to school, are there any ways that they could realistically, tangibly reduce the cost of higher education?
The best way to do that is to finish on time. Most students for a bachelor's degree do not finish in 4 years anymore.
Why does that matter?
Because you pay for an extra year, plus you're not out working full-time for an extra year. So you have the actual tuition price, you have living, and then you have the opportunity cost of not working.
So if a student says, you know, and again, we're not talking about illness, we're not talking about a family situation. If a student says, you know, I'd like to chill this semester. I'd rather not have the pressure of having to study, you've got exams. I want to just take this semester. Parent says?
You shouldn't do that. You should take as many credits as you reasonably can, and even if it means you work less and take more classes, even if that means you borrow more in a given year, if that gets you through faster, it probably means less debt in the long term and more earnings in the long term.
That's interesting. I often think about the majors that people choose, students choose. If someone chooses art education and his or her parent says, you know, art education, how much money can you make in the field of art education? The student says, but this is what I'm passionate about. This is what I care about, whether it's music or whatever it is, or political science, the social sciences, if you will. Does it matter that much what the major is? A, in terms of income that's potentially earned, but B, shouldn't it be, loaded question I know, what the student's really interested in?
It matters a fair amount what students major in, but what I'm more concerned about is, can you make a decent living? If you don't care just about income, if you're happy making $50,000 a year or $90,000, then you can major in most fields and do okay. But if you're about making as much money as possible, then you choose your major much more carefully.
How about you making 80 or 100 grand and you're miserable and you had the right major to help put you in a position to meet the right people, to be in a field that's attractive, but you hate your job.
It's not going to be your job for that long then. At some point, you'll get tired of it and leave.
Curious about this. There are people who are in the workforce right now who are more and more people are going back, and I'm curious about this. Are more and more people going back who have been in the workforce, not traditional students if you go in terms of age, but going back to get a degree, an advanced degree, whatever degree they didn't get before, or are they just going to go without matriculating?
Most people are going to get a degree or credential. And the big growth right now is people pursuing graduate degrees, people going for undergraduate degrees. That gets much larger during a recession, when you may not be able to work as much, or you need that credential to get your foot back in the door. But right now, it's much more at the graduate and professional level. Next recession, we'll see more growth at the undergraduate level.
Robert, it's interesting. The title of your book, Higher Education Accountability. Accountability to whom?
I wrote the book looking at accountability to everyone. That colleges think about accountability sometimes, that they're trying to respond to the federal government or responding to the state or accrediting agencies or what even the public wants. But they often don't think about these pressures all together and sometimes pushing in different directions. And that's why I wrote the book.
But isn't primarily the question of accountability about accountability to students?
The goal is to protect students. And accountability, say, from the public is really focused on students. Accountability from the state, for example, may be focused on students. It may be focused on economic development needs.
Yeah, I'm curious about the whole community college question. As we do this program right now, in the spring of 2018, Governor Murphy's talking about proposing free community college. Do you think it makes sense?
There's a strong argument to make for it in terms of, for many students, community college is already tuition free, but the price tag is still about $200 million.
Okay.
And I don't know where they're getting that money from.
The other part of this is, as we do this program, there's always a presidential tweet, if you will, coming out. Georgette, help me on this, who's in my ear. Actually, the president tweeted recently that community colleges are, I'll paraphrase, you can check it out, are more like vocational schools. Now, people can decide for themselves, is he right?
He's half right. So community colleges serve two purposes. They serve workforce training in the short term. If you want to learn basic accountancy, welding, things like that, community colleges are a great choice.
Are they also not a stepping stone for those who go to four-year schools?
That's the other function.
Okay, so that's not an accurate tweet.
It's half true.
Respectfully, if you leave the other half out, which is that it gives people an opportunity to go to a four-year school, the people can decide for themselves, but there's an accountability question in how we communicate as well. And so Robert Kelchen is the author of Higher Education Accountability, and your publisher is?
Johns Hopkins University Press.
Go out there, check it out. And Robert, I want to thank you for joining us, because all of us, one way or another, are affected by either through taxes or through our own children going through school. By the way, one more thing to disclose, Seton Hall University is, in fact, one of the underwriters of this independent nonprofit production company. We'll be right back right after this.
To see more Caucus New Jersey with Steve Adubato programs, visit us online at steveadubato.org. If you would like to express an opinion, email us at info@caucusnj.org. Find us on Facebook at facebook.com/Steve Adubato PhD. And follow us on Twitter at Steve Adubato.
We're pleased to be joined by our good friend Beverly Lynn, CEO, Programs for Parents, which is, tell folks.
Programs for Parents is a child care resource and referral agency here in Essex County, and we have sister agencies in every county in New Jersey. And we all do pretty much the same thing, is making sure that families have access to child care subsidies. They would come to our office, parents who are working or in school and needed child care, to find out whether they're eligible for child care subsidies, and those subsidies help pay the cost of child care.
So let's break this down a little bit. You've been part of our Right from the Start NJ series, our public awareness campaign. And by the way, go on our website right now, get important information on that site, Right from the Start NJ. You see it on your screen. It's got articles, research, resources, and by the way, your organizations would be tied to that as well. What do we mean by finding out about the child care subsidy? What is it? Why does it matter? And why wouldn't people somehow know about it?
Well, unfortunately, people have children and they're just not aware. They know at some point they need childcare if they're working or in school, but they don't know how to go about looking
What's
for it.
the subsidy?
The child care subsidy is actually a dollar amount that they're eligible for if they meet the eligibility
From whom?
criteria. From the state of New Jersey. It's all funded by federal dollars.
So it's the
through the
Washington,
state.
D.C. sends dollars to the state in the form of this thing called the child care subsidy.
That's correct. It's called a Child Care Development Block Grant.
Say it again?
Child Care Development Block
It's
Grant.
a block of money.
Yes.
How does it get distributed?
It's distributed based on some allocations that the state makes, and of course Essex is the largest county in the state, and so we probably get a higher proportion than other counties based on the income and some other demographic information. So we're serving about 10,000 children in Essex
How
County.
does it help? How does this subsidy, the child care subsidy, actually help a family and those children, you know, birth to 3, get what they need?
Well, there are two parts to it. One is helping parents pay for childcare. So wherever you go, you're going to have to pay unless you're going to a Head Start agency. And so when parents look at that cost, it could typically be anywhere from $7,000 to $12,000 a year.
Prohibitive.
Prohibitive. In fact, I think the higher level is probably in line with tuition for one of our universities.
Wow.
So unless you are doing pretty well financially, you really can't afford the full cost. And the subsidy helps to offset that. It does not pay for the full cost. Parents must pay a co-payment, meaning that there's a certain amount of that allocation that parents have to pay if they're working or in school. If they're at or below 100% of the federal poverty level, there is no co-pay. However, if you're above that level, then yes, you have to contribute.
The other part of this, Beverly, I'm curious about, and we've been a part of a variety of forums that talk about these issues, and you're part of our Right from the Start NJ family, and we can't thank you enough for that. But one of the issues that kept coming up in one of the forums is advice to parents on how to select, how to pick the appropriate child care facility for their individual 1, 2, 3-year-old. How do they do it?
Well, there's several options. One, if they call our agency, we will give them information about what to look for.
By the way, your agency will be listed on Right from the Start NJ, so go ahead, keep talking.
So we'll actually give you a checklist, questions to ask.
Such as?
Well, one of the questions is, although most centers are licensed, parents need to ask that question. Are you licensed?
Is your center licensed?
Is your center licensed? Where can I find out more information about your track record? So the child care center's records in terms of their licensing status is now online.
Is it public information?
Public information.
Someone says, well, listen, that's private. That's just not true.
That is not true. You can go online to Department of Children and Families and...
Excuse me, there is something called the New Jersey Department of, is it the office or department?
It's the Office of Licensing in the Department of Children and Families.
By the way, the Department of Children and Families, we're doing this program after Governor Murphy has become Governor Murphy. There is a new head of that particular agency dealing with families and children, if you will. That agency, that new member of the governor's administration will be highlighted and also be interviewed as part of this series Right from the Start. NJ, do you think it's very difficult, Beverly, for parents who are dealing with a whole range of issues to understand the government agency to go to the website? How do I find out this? Where do I get?
It can be very confusing, and a lot of times parents don't know where to go. So what do they do? They use their own judgment. They rely on their friends to tell them what to do. A lot of parents find out about us by word of mouth, although we're out telling people about the program and sharing information with families. They still don't know about it until it's time for there's a need for the services.
You know, one of the other issues that we didn't get a chance to talk about, well, we talked about a little bit in our forum, our Right from the Start NJ forum, but I want you to talk a little bit more about professional development for child care workers. What does it, you're talking about training?
That's what it is, training and...
What's required, what's needed?
Well, for infant toddler programs, there are no real requirements for classroom teachers. I have to say that preferably people are hiring high school folks with high school
Preferably.
diploma. Preferably.
Isn't it required?
A high school diploma is not required to work in an infant toddler classroom. Now, of course, if you meet some higher standard, early Head Start, there are higher standards. All
Because that's a
teachers-
federal program?
Because it's federally funded. For centers that are participating in Grow NJ Kids.
Grow NJ Kids, it'll be on our website. What's required there?
They are required to have a CDA, which is a Child Development Associate Credential. It's a credentialing program, but it's a national credentialing
Yeah, but you know,
program.
it's interesting. Beyond all this credentialing, if you will, what I'm curious about is, what are the skills? Beverly, what are the actual skills that a quality child care professional would need to help a 2-year-old, a 3-year-old, a 1-year-old? What do they need?
Well, they certainly have to have an understanding of child development. And I would even say a lot of information about brain development, because we talked earlier about brain development.
It's been a big part of the discussion. How would a child care professional know about brain development?
Because they would actually attend classes. Now, my agency also has a program called New Jersey First Steps.
New Jersey First Steps.
And that is a professional development program, and we also provide technical assistance in the northern region of the state. So we're covering Essex, Hudson, Passaic, Bergen, Morris, Sussex, and Warren counties. We have staff who are trained. They are infant toddler specialists. They are credentialed. They will go out to their a center or even a home provider and provide assistance, technical assistance, resources, information, and we also provide training. So our goal, our responsibility is to go into those programs and make sure they understand child development and brain development and understand what their role is in terms of building those positive relationships.
Beverly, I want to thank you for being part of the Right from the Start NJ public awareness campaign initiative, because you add so much and the work you do every day matters so much. Thank you so much.
Thank you.
Appreciate it. We'll be right back right after this.
To see more Caucus New Jersey with Steve Adubato programs, visit us online at steveadubato.org. If you would like to express an opinion, email us at info@caucusnj.org. Find us on Facebook at facebook.com/Steve Adubato PhD. And follow us on Twitter at Steve Adubato.
We're pleased to be joined by our friend Dennis Wilson, President and CEO, Delta Dental of New Jersey and Connecticut. Good to see you, Dennis.
Good to see you, Steve.
A couple things. You were saying that there was a recent study by the Pew Charitable Trust.
That's right.
They did a study. What was it about, and why does it matter in terms of oral health?
The Pew Charitable Trust, and they do just some great research and some great work, both philanthropic and otherwise, but for the past several years, they've assigned letter grades based on their research in terms of how each state fares relative to its treatments of children from an oral health perspective. You know, how well are our kids being treated? Unfortunately, New Jersey got a F letter grade.
An F?
An F. And we're in the company of Wyoming and Hawaii in that basement.
Why did we get such a low grade?
We got such a low grade, and usually it's explainable because there's not access or the number of dentists or some other factor. Here it's pure regulation and pure policy. We have the most restrictive policy in the country as it relates to the ability for a dental hygienist to apply varnish to a child's teeth. And varnish are just a protective shield,
right,
which are 80% effective in preventing cavities. So it's a policy and regulation issue. We've taken some steps. New Jersey has taken some steps to ease the regulation a little bit. Now it's about enacting the right policy and making sure that the dental community is just aware of what they can do and what the restrictions are.
Okay, the other issue I want to talk about, diabetes and oral health.
Right. So 18 months ago, Delta Dental went to the dental board, the Board of Dentistry in New Jersey.
They regulate dentists.
They regulate dentists, and they regulate how and what dentists can practice. In other words, what is included under their scope of license? What can they do? So we just asked a simple question. can a dentist administer a diabetes test? Can they, if properly certified and trained, do they have the ability to test for diabetes? Not interpret, not
Test.
test.
What was the answer?
Period. The answer is yes. And we found that, one, encouraging and amazing, because the dentist, we thought, has several more shots at bats, if you will, with the patient. If a patient is pre-diabetic, as an example, and by the way, there's over 2 million pre-diabetics
And getting
in the
folks
state of New
early, I'm
Jersey.
sorry for interrupting, Dennis, identifying it early, detecting it early matters. Why?
It matters because, one, you can just alert that patient that they are predisposed to diabetes, and two, just tell the patient, go see your primary care physician, go see your doctor, and go get information about the treatment of diabetes and put yourself in a program.
Real quick on this, Dennis. Should people ask? I mean, we're in the business of giving out valuable information to people. You're saying, going to your dentist, you can ask, can you test me for?
Sure. Here's where we are now. We did a beta test in two cities, Trenton and Newark,
Right.
With a group of dentists.
Focused on urban areas.
Focused on urban areas because we wanted to find out if there was something there.
Right.
And there was certainly something there. So our next step is to take it to some, I think, forward-thinking customers of ours in the healthcare space, and asking them to integrate that benefit into their dental benefits program. And then we would train the dentist, enlist the dentist to make sure that there was adequate access for the patients, for the employees of these employers, these healthcare employers, to have this testing done. We think we're going to find something there. And then the next step is we're going to go statewide with this and make it a standard part of our benefit plan offerings.
Real quick, by the way, I should say that Delta Dental has an annual golf outing.
We do.
Glad to host that supports Special Olympics of
Yes.
New Jersey. Tell folks why that matters so much.
It's our 27th year in supporting Special Olympics, and we've given well over $1 million to Special Olympics through the course of those 27 years. And this
Great
is
event.
It's a great event. We are a sponsor for the Winter Olympics Games, and it's our signature event for Delta Dental in New Jersey.
Also, you're very supportive of the work that we do at this independent production company as well. I just want to disclose that.
Thank you.
The pediatric piece, it's important. The pediatric care.
Yes.
What do we define pediatric? What age?
Usually, technically, it's really under 18, but for practical reasons, it's really under age 12.
What are the challenges? Biggest?
The biggest challenges, quite frankly,
Because we have 13 and 15-year-olds, and I told them you were coming on. I'm like, you need to do the right. They're like, what? I did it 2 days. What? Every day, flossing.
Yeah.
Is it hard with this population?
It's routine is hard with this population.
Doing
Good
it all the
oral
time.
habits, doing it all the time, doing the right things all the time. And actually, it needs to be encouraged and talked about in the schools. It needs to be encouraged and talked about with the child's pediatrician, as well as pediatric dentist. The best place is to start early. Before age 2, bring that child to the dentist.
Go back to the school issue. In schools?
Absolutely.
To what degree is it happening?
Well, we have a kind of a fun program. We call it Captain Supertooth. Captain Supertooth is a superhero type character. Schools love it. He comes in, he's entertaining, he's an actor, he's on retainer with us, and he talks to kids about good oral health habits, what they should do, what they should look for, and so forth. Amazingly popular.
Is it about making it, I dare use the word, fun, Dennis?
It's about, to some degree, it's about making it fun. It's about brushing your teeth before you go to bed with your parents. It's a family activity, and it just should be part of what you do.
Real quick, before I let Dennis out of here, the other thing I've learned from speaking to some of the dentists associated with the organization is that oral health is the gateway, if you will, to not just diabetes. Real quick, isn't it heart-related issues as well?
Heart-related issues, when a woman learns that she is pregnant, the second place she should go literally is to the dentist. First to her doctor, then to the dentist. Because periodontal disease, oral infections, tooth decay, things like that all matter when it comes to appropriate prenatal
Overall
health. That's right.
Dennis Wilson is President and Chief Executive Officer of Delta Dental of New Jersey and Connecticut. Thank you so much, Dennis. Appreciate it.
Thank you, Steve.
Well done.
Thank you.
The preceding program has been a production of the Caucus Educational Corporation, celebrating over 25 years of broadcast excellence. Funding for this edition of Caucus New Jersey has been provided by the Turl Fund, supporting Right from the Start NJ, Wells Fargo, Holy Name Medical Center in Teaneck, New Jersey, New Jersey Sharing Network, Fedway Associates, NJ Best, and by the law firm of GIBBONS PC. Transportation provided by Airbrook Limousine, serving the metropolitan New York, New Jersey area. Caucus New Jersey has been produced in partnership with TriStar Studios.
My name is Dr. John Rundback. I'm actually the medical director of the Interventional Institute here at Holy Name Medical Center. Peripheral arterial disease actually is extremely common. It's one of the forms of hardening of the artery. As interventional radiologists, we perform minimally invasive image-guided procedures. Generally, the procedures we do are alternatives to what would otherwise be major surgery. Almost 80% of those patients can avoid amputation if they're referred for us for these sort of procedures.
Holy Name Medical Center in Teaneck, New Jersey, 1-877 Holy Name. Healing begins here.